Good morning friends. This is a video demonstration of hydrozone with MAHT for an avascular necrosis of hip with extremely limited joint space, in which the process of arthrodiastesis is being described. We first open a 50 cc syringe and a 10 cc syringe. The 50 cc syringe will be used to fill with ozone. The 10 cc syringe is used to fill with hydrogen, and we are going to inject both of these into the hip joint. So, with the three-way, we connect the 20 cc syringe and the 10 cc syringe to the three-way. This is interconnected, and to the lower end a needle is connected. This sort of sterile assembly is made first and tested for patency. We now test the ozone machine and ensure that ozone smell is coming. Ozone is heavier than air, and thus 40 to 50 cc are extracted in a syringe, which is now attached to the three-way. As long as the syringe is kept vertical, the ozone will stay in the syringe. So we extracted 50 cc of ozone, attached a three-way, and the nurse is holding the syringe. The other end, we will attach the syringe with hydrogen. A cocktail of hexadiluted xylocaine, low-dose kinocot with 30 micrograms of clonidine is injected into the joint. The joint is first cleaned. This could be done in an operation theatre. We locate the joint, go into the hip joint, suck and aspirate and see, and then the cocktail is injected. However, the needle is not removed from the joint, that retains in the joint. The molecular gases are going to be injected through the same needle. Multiple punctures are avoided. Only then we will get an arthrodiastesis, which will distract the joint. As hydrogen is lighter than air and hydrogen escapes from transparent syringes, that is extracted the last and attached to the other end of the lure. We can see that hydrogen is being extracted from the machine. This is 99.99% pure hydrogen. The same is attached to the three-way. Now we have locked the nitrogen to ensure that the nitrogen stays in the syringe. The needle is in the hip joint. We now attach the lower lock to the needle. And first open the passage for hydrogen. After injection of hydrogen, we turn the knob to allow the ozone inflow to be free, and now we inject the ozone. As the connection is open, we will ensure that both syringes are pushed. There is some pressure in pushing, as arthrodiastesis takes pressure to open up the diminished joint space. If the procedure is done under C-arm, we can see the joint opening up. The C-arm images posted subsequently do not belong to this patient and have been sent to me by Dr. Jignesh Patel. You can see that as the ozone is injected into the joint space starts widening. In the next part of the video, you will see how the joint, which was very narrow, gets well distracted with gaseous arthrodiastesis. This will ensure that the patient has better hip movements after a joint is created. We can see the video and we can see the needle going in and how a dye is injected to ensure that it's in the joint, and how the injection of the gases will increase the space of the hip joint. Grateful acknowledgements to Dr. Jignesh Patel for sending this video of live arthrodiastesis. In patients with avascular necrosis, this is followed by a UVBI MHT, about which many procedures already exist. 50 cc of blood is ozonized with 50 ml of 70 microgram ozone and retransfused. We first take 1 ml of heparin. This is put through the small circle in the MHT bottle. 0.5 ml of heparin is next collected, and this is introduced into the latex rubber free transfusion set to prime the set. Experienced ozonotherapists do not use heparin because the blood flows very fast and there is no chance of it getting clotted. But for the beginners, it is recommended that you coat the inner layer of the transfusion set with heparin so that the blood does not clot in the process. The lower end of the set is now attached to the butterfly, while the transfusion set is pulled through a UVBI stand. UVBI stands for ultraviolet blood irradiation. The blood that is going to be collected from the patient is going to be irradiated with ultraviolet light, and the same has to be transfused into the patient again. A tourniquet is applied. The vein is identified after the patient is asked to compress his wrist and hand a few times. The venflon is now inserted into the vein. The patient has got good veins. You can see the blood flowing in. Now the sharp end of the transfusion set is pushed into the vacuum thinner bottle. And you can see the vacuum tube bottle has such good vacuum that the blood travels against gravity and fills the bottle. We have to wait till 50 cc of blood is filled in the bottle, after which the inflow tube is blocked. We collect 50 ml of 70 microgram percent of ozone into an ozone compatible syringe, and we attach a thick needle to the end of the syringe. The needle is bent at 90 degrees and then it is inserted into the plus symbol of the bottle, which takes it straight to the diffuser. Because of gravity, because of vacuum, the ozone will get sucked. The syringe is opened so that it acts as an air vent. The ultraviolet lights are switched on and the bottle is put into the UVBI stand. The flow is open to full and ozonized blood is now allowed to transfuse to the patient. We can see that the blood color has turned cherry red. The whole procedure takes 5 to 7 minutes, and UVBI is known to be highly effective against all bacteria, virus, parasites, fungi, helminths, and also acts as a strong antioxidant against pollution by hydrocarbons and pesticides, insecticides, etc. Once the transfusion is over, the set is unplugged from the bottle and the remaining blood is allowed to drain into the patient. The important step here is that we must use lot of padding and a tight adhesive bandage after removal of the butterfly, because we have used heparin, and if the bandage gets accidentally removed, there may be a lot of bleeding which might scare and panic the patient. So in this video we saw a hydrozone injection of the hip. You can see the patient is hyperflexing the affected hip within moments of arthrodiastesis, and gaseous arthrodiastesis is followed by UVBI MAHT. This procedure recorded in real time, including titling, is less than 15 minutes, which is the time of the procedure from start to finish. The set is disconnected and the patient is padded and strapped. For further details and courses on ozone or hydrogen, please text me on WhatsApp on the above number. Thank you, thank you, thank you.